to Medulla channel. Our topic for today is facial nerve. Facial nerve is also called as the seventh cranial nerve. So without further delay, let's start the topic. So as you can see in the diagram over here, this entire region is your pons, and this comprises of a superior colliculi and an inferior colliculi. When you take a transverse section or across the inferior colliculi, you get something like this. Now, the number one thing in facial nerve that we will learn is the origin of the facial nerve. Now, any origin will happen from a nuclei because it's a nerve, correct? So, there are four nucleus which gives rise to facial nerve. The number one, that the most important, that the motor nucleus of facial nerve, which is marked in the red. It forms a loop around the abducens nuclei to form a special visceral efferent which supplies all the muscles of the face, the expression muscles. Alright. Then the brown nucleus over here, which I've highlighted, this nucleus is called as your nucleus of lacrimatory, and it forms your general visceral efferent, and it will supply the lacrimatory gland, your salivary gland, and submandibular gland in the face. Then the sensory supply. Now it's very important. The first two that I highlighted were motor supply, that will send impulses from, let's say, from now, the brain to the face. But sensory will supply it from the face to the brain. Now the brain, which I'm using a term over here, is nothing but the pons. Alright, just to make things easier, I'm using it brains. So number one sensory is a special visceral efferent, the one in the green, that sends impulses to this nucleus of tractus laterus. And then second sensory one is a general visceral efferent that will supply the spinal nucleus in the tract of trigeminal nerve. Alright, so I hope the four nuclei of facial nerve is crystal clear. So now let's move on. Okay, so before moving on, I'll just give you some brief. The one which I mentioned in the green, the special visceral efferent, it supplies the anterior two-third of the tongue. Means all the sensations from the anterior two-third of the tongue is transmitted to this particular nucleus of tractus laterus. Then general specific efferent, it supplies the sensation from the skin of the auricle. The skin of the auricle, the sensation from that is supplied to the spinal nucleus and tract of trigeminal nerve. So now, without further delay, let's go to the next subtopic. Now, this is something important, but before we do that, I would like to explain the course of the facial nerve. Now, this is something very, very important where majority of people are not able to understand this basic concept. So basically, it starts with the pons. It goes to the cranial cavity. Then it goes to the internal acoustic meatus. That's nothing but the opening in the ear. Internal opening of the ear, internal acoustic meatus. Then it goes in the internal acoustic meatus and forms the facial canal, which is divided into your labyrinth segment, your tympanic segment, and your mastoid segment. So basically these segments are these segments are a part of the canal in which the facial nerve travels. Now this is very, very important. Alright. So from the mastoid segment, then it takes an exit via the stylomastoid foramen. Then it goes to the parotid gland, and at the superficial plane of Pade, it divides the parotid gland and supplies the facial muscles. Now this is a bit confusing, but as in I teach you afterwards, you'll get to know it better. So just have some patience. When we speak about the features of the facial nerve, it's basically the branches. Alright, so now we have the origin as we discussed, the pons. Then it has a motor root and a sensory root. So pons to the cranial cavity. So over here it goes to the cranial cavity, and it gives rise to some nerve called as a superior petrosal nerve that supplies your lacrimal gland. This is a secretomotor nerve. Alright? Then it goes over here. Then this opening, it goes via the opening called as your internal acoustic meatus. And because stapedius is a part of the ear, therefore it will give nerve to the stapedius. Then as we go down, it gives a branch called as chorda tympani, which will supply sensory supply to the anterior two-third of the tongue, and motor supply to the sublingual gland and the submandibular gland. Alright. Then it takes an exit via stylomastoid or foramen, and it divides the parotid gland into two halves and gives rise to five branches, namely temporal, zygomatic, buccal, mandibular, cervical. Now, other branches that you need to remember is once it takes the exit, posterior auricular nerve, nerve to posterior belly of digastric. Alright, so these two just wrote up. There's no other trick. Lesions. Lesions is the most clinical topic of facial nerve, and you should know on your fingertips. So lesions are divided into upper motor neuron lesions and your lower motor neuron lesions. Now I like to remember this in this way. So whatever I'm saying right now, just pay very much attention to it. Alright, so remember, so brain, the cortical areas of the brain will regulate the pons via something called as your corticonuclear fibers. So brain to the pons, that region, if there is lesion, it's called as upper motor neuron lesion. Now from the pons, as we studied that there are four nuclei which gives rise to all these kind of fibers. From there onwards to all this region, if any lesion happens over here, then we say it's a lower motor neuron lesion, your LMN lesions. So I hope this is very clear. Now if you see, this is a facial nerve nucleus. Basically this nucleus, nothing but this is the pons region. Alright. So if it's an upper motor neuron lesion, then only this much part of the body, of the face, is affected. The lower 1/4 quadrant. Alright. But if it's a lower motor neuron lesion, then one side of the face gets affected. Alright, this is very important, okay? Now we'll try to understand the lesions. So let's divide this lesions topic into four subparts. So all the lesions that happens over here, as I said, it's lower motor neuron lesion, correct? So we'll start with this particular site written as A. If there is a lesion over here, alright, if there is a lesion over here, that means this part of the thing is sacrificed, correct? So the facial expression muscles are not supplied because these branches are not, because there's lesion at the particular site A. So there's something called as Bell's palsy that happens over here, in which there's a deviation of the mouth to the normal side. Yes, you heard that right. The mouth is deviated to the normal side. Alright, and there is a paralysis on the affected side. Very important, alright. Then we go to the site B. Now, if there is a lesion over here, there'll be Bell's palsy. Yes, there'll be Bell's palsy. Plus, there'll be loss of sensation in the anterior two-third of the tongue because of the chora tympani nerve is getting affected. This is another very important thing. Alright. So there's two things. If there is lesion at site B, there's Bell's palsy plus anterior two-third of the tongue sensation is lost and the motor supply to the sublingual and submandibular gland is affected. If there is a lesion at the particular site C, then lesion of A plus lesion of B plus lesion of C, that's the nerve to the subA, is getting affected. Therefore, there is, if now the associated symptom is that there is a hyperacoustic. In sense, there is a higher sensitivity to hearing that's seen. Alright. Then, if there is a lesion at this particular site, that is D, then everything that's lesion of A, lesion of B plus C, and because it supplies the lacrimal gland, therefore now lacrimation is affected. Therefore, D is associated with lacrimation plus the lesion of all A, B, and C. Now, if the site D is associated with herpes zoster infection, then that is called as your Ramsay Hunt syndrome. And if it's infected by this particular virus, we just term it as a Ramsay Hunt syndrome, which has the characteristic lesion of A plus B plus C plus D. Alright. So now one last thing that I want you guys to know is that the crocodile tear syndrome. It's a pretty interesting one. Crocodile tear syndrome is nothing but whenever you start eating, there is lacrimation. Why? Because a ganglion, that is your geniculate ganglion over here, there is a lesion proximal to that. Alright, that's all you have to know.